Hello. I'm hoping that this is working correctly. My name is Dr. Regina LaRocque, and I am a board member of Sustainable Wellesley. I'm also an infectious disease physician and researcher at Mass General Hospital and Harvard Medical School. I am a natural resources commissioner for the town of Wellesley, and I am a mother of two 13-year-old boys, and I'm married to my husband, who is also an infectious disease physician. And I'm here to continue to answer questions and try to provide insights to people who live in my community of Wellesley, Massachusetts. And I'm here to speak simply as somebody who has a certain level of professional insight into what's going on. I'm really just representing myself, and I'm not representing any of the organizations I'm associated with in any official capacity. But I would like to be able to just share some considerations that I've had in recent days, and also answer some of the questions that were shared with me. So I want to start with one small point that was raised to me about hand washing and the role of alcohol-based sanitizers versus soap and water. And I just want to quickly say that it's a well-known fact that alcohol-based sanitizers, although very convenient, are not always effective against certain types of viruses in particular. So that's why the messaging around this virus has focused a lot on hand washing with soap and water, and reminding everybody that it's important to spend a good 20 seconds or more washing with warm water and soap. And it's important to do that every time before you eat, and also after you've been touching anything. Remembering that, of course, the virus, as a respiratory virus, often spreads when we touch surfaces and then touch our face. So I just want to make the point about the importance of soap and water. One of the things that I thought it might be helpful to just think about now that we are entering a new phase of this here in our own communities is kind of how I think about the long game of what might play out here. So I just want to share a few thoughts on that, because I think there's a lot of uncertainty, and that is definitely going to be the case because there's a lot we don't know. I just first also want to make the point of what we're seeing here in Massachusetts, which I want to underscore in the strongest possible terms, is the beginning of an explosive epidemic. I think we should have our eyes on the fact that this is like a tsunami that is coming. And in the early phase of the tsunami, there's that period when the waves the water starts to go out and the beach appears, and then the tidal wave comes. So we know that the water has begun to recede and the tidal wave is coming. And we are seeing that already here in Massachusetts. We have a rising number of cases of people hospitalized, even severely ill and hospitalized with this disease, and deaths occurring. And it is alarming that in this setting, that is the very earliest phases of this epidemic, we are already experiencing a critical shortage of supplies. This is even before the onslaught has begun. So we are running out of masks, personal protective equipment, basic laboratory supplies already. And this is awful. This puts everybody at risk, particularly healthcare workers and first responders. Everybody who are doing those types of jobs are at risk. because of the absence or the looming lack of capacity to protect ourselves. It also puts the entire community at risk because you don't want your first responders and healthcare providers spreading disease to others. You want them to have maximal protective equipment. And so, I'll share that we have seen in our institutions a tremendous outpouring of volunteer efforts to supply us with equipment. And I believe that my own institution has set up now a more centralized way to receive and distribute supplies. And of course, this is wonderful. And this is a representation of the outpouring of concern in the community. But on the other hand, this is not a problem that can be solved by an outpouring of volunteer efforts. Our own Senator Markey has said, and I fully support his assessment, that we need a war-like mobilization of our production capacity in this country to provide all healthcare workers and first responders with the appropriate supplies. And the response on the federal level in supplying these materials to us in Massachusetts has been insufficient. And we consequently need to seize responsibility in our own community for making these supplies available immediately by all means possible. So that's what we're seeing on the ground. And again, with the fact that this is the very earliest days of this, it's concerning. So back to the question I posed for myself, which is, how do we kind of think about where this is heading and what's the long game here? And so I just want to make the point that I believe people understand, but just to be clear, this is a virus that nobody in the world has been exposed to before, which means we are all susceptible to getting it, and exquisitely susceptible to getting it. And some of us are exquisitely susceptible to dying from this. And that is a higher risk in certain categories of people, but is true across the board for all categories of people. People can die from this even at younger ages, people who appeared relatively or completely healthy otherwise. So the risk of death is not limited simply to people who have existing medical conditions. It cuts across all age groups, which is an important point to understand. So we know that when a virus or an infection enters a completely susceptible community, it follows a common pattern of what's called an epidemic curve, in which there is a rapid exponential increase in the number of cases, and then it levels off and goes down. That's the epidemic curve. The main factor that limits the speed and the main factor that leads to the cessation of the epidemic really is that enough people in the community become immune that the infection is no longer able to circulate well within the community. And that's really what stops the epidemic and allows it to go down. So we've been fortunate to live in an age when we can create that immunity in a population by vaccination. And so we rarely have ever really experienced these kinds of epidemics. We have tools to slow them down. In this case, we don't have those tools. And so if this is allowed to play out, without any intervention, there will be a rapid exponential rise in the number of cases that will go on until about 75% of the population has been infected, and then the cases will begin to decline. And of course, in the process of that taking place, some very terrible things will happen. Many people will die, and they will die in short order. And it will overwhelm our healthcare system. And that's really the big concern. So what we are doing now is, I will say, we are hunkering down. we are applying the means to slow this epidemic down that are available to us, and that really just includes the very basic tool of distancing ourselves from each other and washing and cleaning and disinfecting and waiting for this tidal wave to hit and trying to make it slow down. And the long game then is we slow it down enough that we don't flood our healthcare system, we don't overwhelm our capacity to deal with people dying, and that in the meantime we are able to develop some tools to combat the situation: a vaccine, better testing, more widespread testing, more aggressive ability to track and contain cases, none of which we really have right now. So we're just buying time until we can develop those tools. And certainly many people I am associated with are working hard on those tools, but they take time, and they won't be forthcoming in anywhere near the short term. I would estimate it's months. So I think that we need to have a realistic understanding of how important social distancing is going to be over a period of time in order to allow us to develop and implement the tools that we need. So these are hard things to do. I think I would say that accomplishing these kinds of measures is really, it's a political response. It is a societal response. It is not just the medical system that can do all of this. And so the important point to understand is that it really is our political leaders at this point who are going to determine how we allow this epidemic to play out. And we're seeing, as we look around in our own country, that different political leaders in different political settings are doing different things. And I think it's important to understand that there's probably reasons for that, because these are very hard decisions to make. We are essentially between a rock and a hard place. And so decisions about what you're going to sacrifice in order to save something else are complex decisions, and I think we should all appreciate that right now they are being made by our political leaders. So a question that came today for me was, can you help us understand Governor Baker's statement today? Do you think it goes far enough? So Governor Baker today issued a advisory that we should starting tomorrow, we should begin to shut down non-essential businesses. So what is my opinion about that? Well, I don't understand it, because I believe we already have an advisory to participate in social distancing. I actually, just before this, took a look at the list of essential and non-essential essential services, and they seem to include almost everything. And so I'm having a hard time understanding operationally what this means. So that's my impression. I think it's important for us all to understand that any of these public health measures that are being implemented really have less and less effect the longer we wait to implement them. Really the most effective time to implement any of this is the moment the illness first arrives. Once the fire is burning inside, once the fire is burning inside the house, the tools you have available to you become less and less effective, and it's much better to avoid letting that spark come in the first place. So I think that I don't understand today's advisory. I'm not sure that it effectively changes anything beyond what we had been supposedly doing beforehand. Although, of course, it is a step in the right direction an incremental step in the right direction. I think maybe there's been some discussion about what the economic impacts of all of this are going to be, and I think it's an important consideration for everybody because, of course, the need to stop going to work or at least to work remotely or to shutter businesses that require interaction with the public, these have economic impacts, and this is what I'm referring to in the sense that these are political decisions that must be weighed. But I just want to do a little thought experiment with all of us, or with myself about what it would be like to allow this epidemic to play out without taking any of these public health measures. And I think that, the way I conceptualize decision making is what are the risks and what are the benefits. So I think about, well, what if we just decided that we were not going to take any immediate measures that sacrificed our economic activity, and we were just going to allow this virus to come into our communities and wreak havoc? What would that look like? We are seeing that already. So what does that look like? Well, what that looks like, I would say, is tens of thousands of our friends, neighbors, and family members dying in a way that would be pretty awful, because we're all accustomed not to being triaged to die. We're accustomed to having our medical system do its utmost to save us. So a medical system that would be swamped and overwhelmed with a rapid onslaught of people dying, people who cut a rather broad swath of our society, but particularly decimating people over the age of 65, decimating people who have any existing medical conditions, any immune compromising medical conditions, basically allowing all of those people to die, making our healthcare system collapse completely, such that we are no longer able to provide any of the routine care that we normally provide, immunizations, well child checks, elective surgeries. We would have to sacrifice all of that. And so I guess my contention is that allowing that to happen certainly has profound economic impacts. I'm not an economist, but it's hard for me to conceptualize that we would have a healthy, thriving economy if we allow this virus to wreak havoc on our society. So we're stuck between a rock and a hard place, I guess is what I'm getting at with that. So somebody's asking, in the absence of urgent enough federal and state action, can medical societies reach out directly to industries to arrange repurposing and manufacturing critical medical supplies? I think this is really the essential question and the essential issue, which is that at this point, our medical professionals, our first responders are beginning to be, and soon will be additionally, completely flat out drowning in work. I think we are already experiencing this where it is impossible to keep up communication with our colleagues. It is impossible, frankly, it is very difficult to stay on top of emerging medical information. We're barely keeping our heads above water right now. So I don't think that we are going to be in the position to save ourselves. We need our political system. We need our colleagues and our community members to have a clear eye about what's happening and speak to our political leaders about how important our healthcare system is and how important it is that we do everything possible to protect us and to save the healthcare infrastructure that we have in our country, that we have developed and put in place for all of our protection. And I think I speak for many of my colleagues now that we are distressed, and we have already seen what has taken place in other countries, and we acknowledge that we're looking down the barrel of the same thing here. And I just want to say a word about what does good political leadership look like at this moment, to my mind. The things I'm thinking about are that I want everybody to acknowledge that we are looking to our leaders to be leaders who are going to have to make difficult decisions on the behalf of all of our communities. And so when difficult decisions are getting made, the things that I like to see happening are frequent communication. I'd like to see transparency. I like to hear about decision making from people who I consider to have expertise. I like to know that the decisions that are being made are being informed by the absolute best information possible. I would like to see that because very difficult trade-offs are going to be made, I would like to see that those trade-offs be made explicit. We could certainly talk about what it is we are willing to sacrifice in order to gain something else. I think part of the reason why these are politically difficult waters to navigate are because, frankly, the mark of success in a moment like this with an epidemic is that people are not dying. Things seem normal. And all of the actions that you've taken seemed preposterous. So it's hard to get credit for something like that. I'm not sure at this point, with the way the numbers are escalating, that we are going to be in a position where anybody is going to look back on what we did and say, well, why did you do all of that? I think we're more likely going to look back and say, boy, we should have done a lot more, a lot earlier. So somebody has asked, once we've been at home with no symptoms for 14 days, except for trips to the grocery, would it be safe to visit with someone else who has also been at home for 14 days with no symptoms? So I think my answer to this kind of plays back to what I was saying about the long game here, and also to the way I like to think about risk and benefit. So I guess there's no right answer to this. There is only risk and benefit. But in the moment right now, I will say we are in the midst of an epidemic. So that to me means that we assume lots of people are infected, lots of viruses out there on surfaces that we may be touching. And we certainly know that people can shed virus before they are symptomatic. And so I'm just going to operate on the assumption that at this moment in history and time, this is the most risky time. There's much that I don't know. So I would say the risk right now is high. And whenever I think about, like, do I want to go visit a family member? Well, what's the benefit? Am I going to visit my parent who is on their deathbed and I will never have a chance to see them again? Well, that's one decision. Am I going to visit a family member who I just miss and I haven't seen in a while? Well, at that point, I would say that in the moment when the risk is highest of potentially infecting somebody else, I don't think the benefit outweighs the risk. So, in my personal situation, I would not want to take risks. And I think we need to be the most cautious we can be right now. Because really the way that you would stop this virus, like imagine the perfect situation in the world that would stop this right away. Okay, what would that look like? What that would look like is every person in the entire world had a bubble around them that went for 6 to 12 feet. And that bubble separated them from every other person in the world, and they stayed in that bubble for about 2 weeks, and they never punctured that bubble for any purpose, not to touch another person, not to touch any object. And during that time, the infection would burn out, it would die on all the surfaces, and it would go away. That's not a situation we can actually create, but that would be what we would need to make this stop. And so the things we have available to us are on a spectrum of how do we kind of achieve that bubble for all of us. Okay, I have a couple more questions here. Are you seeing any instances of reinfection, or are you finding that those who have recovered are building antibodies to this? Well, that, of course, is an excellent question. That is the fundamental question. We have to study that. We don't know the answer to that. Many of us are working on that. These are the kinds of things these tools that we need to develop during this hunkering down time, because then once you can test somebody's blood to see if they have antibodies and are protected, well, that would be such an important tool to have. Then you could go out into the whole community and you could find out who's immune and who's not. It's an essential piece of information. We have to get that. We don't know yet. One thing I just want to say also, just to kind of think about the long game, which is we don't know the long game with this virus. I just want to explain that the way things work with many seasonal viruses, and what might actually end up transpiring with this virus as well, is that once they've entered a population, then they're there, and it could be that coronavirus at some point could develop its own unique epidemiology in association with the human population. That's one of the fears that we all had in this virus entering the population, is we don't know what things are going to look like, in coming years. If this becomes like the flu, where every season it emerges and people get sick again, that's concerning. We don't know if people are going to be immune after they're infected. I would assume they're going to be. That would make sense. But we don't know if this virus might enter another reservoir in the world, another animal reservoir where it could lay dormant and then re-enter the human population again. See, there's many things we don't know about what the long game is going to be. And I think that the question here is one of the ones that we all want to understand also. Somebody's asking, I'd really like to understand better the airborne risks in inside and outside spaces. Well, I guess just the fundamental thing I'll say about that is that ventilation is a good thing whenever anything is transmitted through air. I mean, you want to have air circulation, keeping, allowing things to move away from people. In the hospital, we put people into special rooms that have filters and that ventilate the air very effectively. And so ventilation is just kind of a common tool to apply when you're worried about spread by droplets or aerosols. And so so in general, I assume that being outside is better than being inside. And so I hope that makes some sense to you. I mean, I don't have tremendous concern as I walk down the street outside and pass somebody at a length of 6 feet that I am going to become infected from them. That is a rather unlikely scenario. And so I would not focus my concern on those kinds of settings. I think of higher concern is that when anybody is out and about, you tend to touch stuff, and that's why playgrounds are a concern, and other places where people are kind of commonly touching the same surface. So I think a more important practice to focus on if you go out is just make sure you wash your hands routinely every time you come back in, every time you eat, as much hand washing as you can, because I think of higher concern, being outside is what you're touching, not kind of who you're passing. So I think I'm going to wrap up. It's been a long day. I just want to share that the important point I have been thinking about a lot today is just remembering that all of the way this has played out to date, and that this will play out going forward, really rests in the hands of our political leaders. And I think we all know that a lot of people failed to really understand the severity of what was coming our way. And now I think we should look to the same political leaders to, who frankly didn't, I think, convey the gravity of what was coming. We have to dance with the partners we have, right? So, my expectation now is we want aggressive, informed, and thoughtful, honest decision-making happening prospectively. And that is what we should be demanding. And I also think that we need to, I ask all of you to recognize that this is a very frightening time for healthcare workers and for firemen and police officers and anybody who's interacting with the public. And to me, it's unconscionable that in the United States we are running out of supplies at this point. It's really shocking, and it really requires a top-down, government-led effort in order to open up those supply chains, and it requires a war-like mobilization of production capacity, and that's what we need to be seeing right away. I very much appreciate that people are making voluntary donations, but that is not enough. That is not going to solve the situation that we are facing here. That is haphazard, and that is uncoordinated, and it's unacceptable. So I would appreciate, people getting the word out that it's happening now, and it's happening at our vaunted medical institutions. So I'm really scared for hospitals that are, serving rural communities, or, places that are not able to marshal the degree of infection control efforts that a large institution in a city can do. It is a full-time effort to contain what's happening. And that is something that I don't think the average hospital can reproduce. So I think that's just the honest assessment that I see going on. And I think people need to be aware of that. So call your legislators. That's my message. I would like to also just end by saying that I don't represent anybody other than myself here, and that I also encourage everybody to seek the most reliable sources of information. And of course, the CDC has it's a fire hose of information on the website, but it's all been vetted and it's really solid stuff. That's a great resource. The Massachusetts DPH and our town website are all places to get up-to-date information. And I believe that the reporting in the New York Times has been excellent. It is very consistent with my own on-the-ground understanding of things. The Boston Globe has been reporting on our local situation very well. And again, one last caution, just remember that the numbers are not interpretable. The numbers reflect information from days ago. They reflect the incomplete capacity that we have to test people right now. So the numbers are meaningless. You have to focus on the fact that there is a tidal wave coming, and we are seeing it now. We are in the midst of an epidemic. Okay, thanks everybody for listening. I will attempt to do this again, and I'm only able to do it late at night at this point, so we'll see. Thank you.